when talking about Reich. I've never known another man in my lifetime of such force and such will and movement and spirit. And Reich always thought of himself as an historical figure. It's interesting that, for example, in his trial was almost like a farce, because some judge had handed down an injunction which Reich clearly disobeyed. So the trial was, did Reich disobey the injunction or did he not? And many times over in the course of the trial, Reich said, yes, I disobeyed the injunction. Now he wanted to tell the judge why he disobeyed the injunction. For example, the injunction said that Reich claimed that he cured cancer. And it cited his book, The Cancer Biography. Now in every case that was cited in the book, The Cancer Biography, the patient dies. So obviously the people who had prepared this case against Reich had done a very poor job, because to say that Reich claims a cure and the patient dies in the book is idiotic. But that was the case, and Reich, instead of answering the injunction, sent the judge all of his books, which is nuts. You don't expect a judge to read all of your books, but that was Reich. Reich was saying, read these and see if this is a valid injunction. So came to the trial, and the trial was terrible, because Reich said, yes, I disobeyed the injunction. That was all they cared about. One day at the trial, things had gone very badly for Reich, and I was standing in an aisle, and I thought, he must be crushed at the way the trial went this morning. He walked over to me, and I had written an article about a review of one of Reich's books. Someone had reviewed, a psychiatrist reviewed one of Reich's books very unfavorably, and I wrote a review about that review. So he came over to me at the end of this terrible session in court, and he said, you know that article that you wrote? He hits us over the head with a club, and you slap him on the wrist. And I thought, my God, you know, at a day like this, when you're about to go to jail, it's clear, all you think about is the article that I wrote. It was too gentle with the reviewer, and that was Reich. Like the fact that he was an historical figure who was fighting for the right of a scientist to pursue his work in peace. The fact that the injunction was the issue, that was a piece of paper to him, an unimportant piece of paper, and he didn't want to deal with it. Any questions that...
We have still 3 minutes.
I have a very specialized question. Do you have some experience working with a medical doorbuster? Medical doorbuster.
Oh, doorbuster.
Yes.
Not very much.
What's a doorbuster?
A doorbuster is an orgone energy device, which door is the accumulation of dead orgone energy, and the doorbuster removes this dead energy. Reich demonstrated the doorbuster to me personally in my own therapy, and in the beginning of my therapy I had a doorbuster and I was using it on patients. One of the problems with the doorbuster is that I could never distinguish between what was the effect of suggestion, what was the effect of transference between the patient and me, and what was the effect of the doorbuster. There was always a confusion in my mind. And the matter was settled when the Food and Drug Administration outlawed all such devices, and like we didn't want to get into trouble. And so we removed those devices from our practices, and most of us have never reinstitutionalized them.
Is that still valid, that law?
It's never been contradicted. Nobody's challenged it since then.
Last question.
Ich hätte noch eine Frage, vielleicht können Sie es dann bitte übersetzen, zu der paradoxen Intervention. Das ist ja meines Wissens nach auch ein Begriff von Reich. Und ich weiß nicht, ob diese Art des physischen Eingreifens, ob das auch damit gemeint ist, also diese Art der Behandlung, oder ob das dann nochmal eine andere Vorgehensweise ist.
She asked if the paradoxical intervention created by Reich is the same as the physical intervention with the body.
I don't know what you mean by paradoxical intervention.
Did you mean, haben Sie gemeint, dass er den Patienten außer Balance hält?
Vielleicht ist das ähnlich. Also ich glaube,
Ja. Ja, es ist eigentlich. It's not right. It's by Frankl.
Oh.
Paradoxical intervention.
Oh.
The family therapist.
Oh.
Yeah. Okay, unfortunately we have
Yes,
to draw
I know.
a line.
I know.
And Dr. Herskowitz, I would like to thank you very much. You are a brilliant and warm-hearted messenger of Wilhelm Reich and your own therapy. Thank you for coming.
And thank you very much for the invitation.
Fresh air. Okay, this was very, very interesting.
Good.
Yeah,
I'm
you're
glad.
really, your way to communicate is very different.
I'm glad. And, you know, I think that it is something that can open doors to other people.
Well, in Europe, they would call it proper
Yeah.
body
Right.
all ways of body. They don't remember
Yes.
coming from Reich.
Yes.
So it's on vogue, partly.
Oh, yeah?
Yeah, sure.
That's
Lots
good.
of books.
Bodily therapy.
Oh, that's
Bodily
good.
therapy. They call it bodily therapy,
That's good. Yeah.
whatever that might be.
Right.
Dr. Herskowitz, unfortunately, I have to leave very exactly now. I have to leave now. So I say goodbye. I send you a check. And once again, thank you very much. It was very nice to have you here, to have some personal remarks on Wilhelm Reich.
Good. Well, thanks again for inviting me.
Okay, okay. Bye.
Goodbye. Yeah.
Darf ich Sie schneller was fragen?
Phuket? Ach, wirklich? Hallo, Herr Killer, wir uns endlich mal kennen, gell? Ja,
I want to know that if December, because of that workshop, about
December? No, he has to leave tomorrow.
Yeah. From US? Yeah. Because when you mentioned that it's very hard to work with adolescents, wie mehr
Nee, das muss man selber discover. Da kommen zwei Leute aus Summerhill, die viel Erfahrung haben mit Everyday und Jugendlichen. Die werden uns einiges erzählen können. Oh, sehr schön. He's a psychiatrist or psychotherapist.
Yeah.
Dr. Linda Miller.
It's a pleasure. Yeah.
holidays I was going to the hotel too. Yeah. So perhaps I think.
Yes, yes, I hope so. Goodbye.
Wir werden